Hi everyone, I'm Alicia and today I'm here with Dr. Bilski from Bilski Dental Group. How you doing today?
Good.
Good. So in this video we're going to be talking about upper mini implants and dentures. So I want to turn that over to you. Tell me a little bit about how that works.
For most part, upper dentures, for a lot of people, stay in by virtue of saliva and suction.
Okay.
There's a large surface area, so it stays in. It's pretty simple. The complaint that we get with the upper dentures or complaints are that they can't feel the warmth of the coffee until it hits the back of their throat. So the question is, on an upper denture, if you even know what they look like, they have the palate is covered.
Okay.
Because we need to utilize that for the suction to create staying power.
Right.
The question is, can we cut out the palate on the denture? Sure, we can do that. You just need implants.
Right.
All right. So in this case, this gentleman had severe sinuses. We can do a procedure called sinus elevation. He was not interested.
Okay.
What is a patient willing to go through? What do they want? And how can we do this?
Yes.
Don't touch my sinuses, doctor. Please stay away from them.
Okay.
Okay. So the only other option we have is placing some implants. And in this case, we chose the mini implants based on cost. And we developed 4 implants up there. And then we took his old denture and converted it. And closely looking, you can see that the denture is cracked, and we're able to repair that and utilize that in the same time. So by nature, we are conservative. We don't always want to redo all the dentistry that had been done prior. In this case, he didn't like having his roof of his mouth covered. We could take that out. We need to utilize mini implants in this case that have a little snap-on attachment inside of his denture that click on, and he's happy. Yeah,
and that was the decision that he made. He decided for that to be his procedure, and that's what it's all about.
No judgment. No judgment. Would I have liked to have seen him going into something bigger, bridges? That absolutely. Would I have liked to have done the sinus elevations? Absolutely. Yeah. Doctor, I don't want to do that. Oh, okay. Then let's do this. Yeah.
I think that's someone, you know, sometimes people's biggest fear at the dentist is, what are you going to do to me? You're just going to do so much to my teeth. But
and we saved him so much time and money.
Yeah. So that's what everybody's looking for.
Minimize the ouch part of it too.
Yes, yes.